Good morning, everyone. Welcome to LisaBug Yoga. We are in the month of March 2023, and our focus for this month is called HIIT. So we are putting high intensity interval training or intervals of some kind in all of our classes today. And the intervals we'll be working on today are for upper body strength. And I know we all fall along that continuum on a different place. So as usual, I'm going to give you lots of options to feel really successful in working the strength of your upper body where you are today. And we're going to use a technique called pyramid training for our intensity intervals with upper body strength. But our assessments for today are twofold. So I'm going to have a seat down on my mat and talk to you about the first assessment that we're going to do. Typically, unless you're on any medications like high blood pressure medication that might slow your heart rate down, a good indication of your overall cardiovascular health is to monitor your resting heart rate. And you'll see that noted as RHR in some studies and documents. So I know some of you have a fitness watch, a Fitbit, an Apple Watch, and that is recording your heart rate all the time through the day. And it records it while you're sleeping at night. And sometimes you'll be able to look that up on your device and it will tell you what your average resting heart rate is. So if you have that type of device and you feel pretty confident that it's accurate for you, you don't have to do this assessment. You can just look at your device and say, oh, my resting heart rate says it's usually 61 or whatever that might be. So I want you to note that in your notes because I'm going to compare that again to about 6 months down the road and see if you see any changes in your average resting heart rate. If you don't have that device, what I would like for you to do, and this again is on your own, is for 3 mornings, and they don't have to be consecutive days, I would like you to take your own resting heart rate, but I want you to take it in bed before you get up, because as soon as you start to rise and move around, it's no longer your true resting heart rate. It's more of an active at rest, and that's going to elevate. So when you're laying in bed, wake up nice and normally, not to the sound of an alarm that might jolt you up or to a dog jumping on the bed, nothing that's going to get your heart rate to elevate. You'll just lay there very relaxed. Find your clock, and I want you to record this for 60 full seconds. Sometimes we'll take our heart rate for, say, 15 seconds and multiply it by 4. But if you're off a beat or 2, one on each side of that, and you multiply that by 4, it's no longer an accurate rate. So you can find your heart rate at your carotid artery on your neck. You can find it at your radial artery on the wrist, thumb side of your wrist, and then count it for 60 full seconds. Write that down, do it 3 mornings, and take an average of the 3. And that's going to be your resting heart rate. And jot that down and have that in your notes. So that's our first assessment that we're going to take this week for this class. The second one is I want you to go out to a drugstore, to a grocery store, and get your blood pressure measured. Now, sometimes we do that on a regular basis. Sometimes we do it only when we go to the doctor. Sometimes we never test it. We don't know where our blood pressure is. So even if you're on blood pressure meds, I want you to get a blood pressure recording and jot that down. This was March 2023. This is my blood pressure. I want you to be relaxed when you take your blood pressure. Sometimes I sit down at the machine and it's really high and I realize, well, I just came in from a run or whatever. So I sit down, relax, take it again. It will almost always drop. So that's your 2 assessments for today, resting heart rate and blood pressure. If you have any questions on those, please get in touch with me. All right, so let's begin our class. I want you to sit nice and tall, hands on your knees, lengthen your spine, close your eyes, and bring your awareness to your breath. And begin to take a calming, full, deep inhalation. Send that breath way down into your belly. Fill your lungs. Fill those lower lobes of your lungs. Let your rib cage expand laterally. And then exhale completely. Either through your nose or you can open your mouth and exhale You can exhale with a constricted throat for the ujjayi breath. It's that whisper breath, sounds like you're fogging up your glasses. That will slow down your exhalation. And while you focus on your breath today, and you can either leave your eyes closed or open them with a soft gaze, we're going to just loosen up our neck a little bit this morning. Our head can move in all directions: flexion, extension, lateral flexion, rotation, circumduction. So we're going to move the neck slowly through all of those modes of movement, starting with rotation. You'll turn your head to the right as far as you can. You can linger there if you'd like, or slowly move right over to the left. So just take this rotation at your own pace and be mindful of your neck, not to force this rotation. And we're observing what we feel in our neck. Maybe you're observing what you hear in your neck, because sometimes I hear crunching noises when I turn my head. And that's just a little bit of degenerative disc disease going on usually. Usually it's nothing to be concerned of, but we just need to notice these things. And we'll finish one more to that left side nice and slowly. Then come back to the midline. Simple neck flexion is we'll drop the chin down toward the sternum, lengthening the back of the neck. And then in reverse, we just extend the chin up. So we don't want to dump the head back. We want to extend upward, increasing the length of the throat. And then we'll take this movement at your own pace. Now, what's kind of nice with this movement sometimes, if you've got a lot of tension in your neck, is to put your fingers, maybe the first 2 fingers or 3, on each side of your neck, on the muscles there. And as you flex forward, you can either give yourself a little acupressure or slightly massage those muscles. And with your fingers there, this will also help you not to throw your head back, because you'll notice if you have your fingers there on your neck, when you go back, it's going to pinch your fingers if you go back too far. So leave yourself some space for 2 to 3 fingers behind you. And then we'll come back to neutral. If you need more time there, be sure that you take it. Bring your hands back down, and we'll do a simple lateral flexion of the neck. So we'll tip the right ear toward the right shoulder. This lengthens the left side of the neck, and then slowly tip the left ear toward the left shoulder. So in a similar fashion, we can assist this by putting a gentle pressure on the opposite shoulder with your hand. So if I'm tipping my head to the right, I'm going to reach across with my right hand and press down. You can also press and rub the side of your neck. And then as you switch, tipping the left ear toward the left shoulder, bring your hand across, press down, or massage the neck. And just take your time, giving yourself what you need here. Again, noticing if you feel any difference from one side to the other. And this should feel nice. We don't want to have pain when we move. So you might have to shorten your range of motion here if you're feeling pain. And let's do this one more time to each side. If this is feeling really yummy and you're really happy about this, starting your day this way, we can thank Nancy. She woke up this morning with a stiff neck, but we hope, Nancy, this is going to really help things for you. All right, let's come back to neutral. We're going to do a half circumduction. We're not going to do a full circumduction because we don't want to throw our head back. So a half circumduction is to tip your right ear towards your right shoulder. Find the circumference of a circle as you come down. Finish the circumference all the way around to the left side. And then come right back through the center to neutral. And we'll go 4 times leading to the right. Lateral flexion, half circumduction, left lateral flexion, and back to neutral. 2 more. And you're letting gravity kind of assist with this as you relax your muscles as you roll that head down. We'll finish number 4. And come center. Now we have the other side to do, but sometimes it's nice to switch the cross of the ankles or just to make an adjustment in the way we're sitting if you feel uncomfortable at all. Lengthen that spine again. Drop your shoulders down. So try not to hunch up while we're doing these exercises. Still engaging your core and focusing on your breath. Let's move to the left side first. Left lateral flexion, half circumduction. Trace that circular position all the way around and right through the neutral line. Now, there's really no right or wrong way to breathe here, just as long as you're not holding your breath. Let your autonomic system decide when you need to breathe in, when you need to breathe out. And number 4, to that left side. Once you come back to center, just check in, see how it's feeling. And then our last exercise is to combine lateral flexion and rotation. So what I'd like you to do is tip your right ear toward your right shoulder, then turn your head to the right. So you're looking toward your right shoulder. As you keep the head turned, lift your head back up to neutral. So you're looking right at the wall next to you, and then turn your head back to center. We'll go to the left. We do a lateral flexion, a rotation. Keep the head rotated, but bring your head back up to neutral so you're looking directly across, and come back to center. Twice more on each side. Laterally flex, rotate, come up, and look forward. Laterally flex, rotate, come up, look forward. 1 more each side. So not only are we releasing tension in the neck, but we are gently strengthening those muscles around the neck to perform these actions. Once you come back to neutral, re-lengthen your spine. We'll take a breath in and open the arms into chest expansion. Pull those shoulder blades back. And then as you close your arms together, wrap the right arm on top and give yourself a hug. And try to pull your shoulder blades apart with your hands. And then we'll open back out. Left arm crosses on top. Try to reach around to your scapula. Pull them apart. And open. Now I want you to notice as I'm pulling my scapula apart, I'm not rounding my back. So I'm just pulling the scapula away from each other to release tension right there in the mid-back. Now let's do one more with the right arm on top. And either stay here, pulling your scapula apart with your fingers, if you can reach back that far. You can find the blade of your shoulder blade, or you can wrap your arms into eagle here. Drop your shoulder blades down. So as we hold this eagle position or your wrap, look over your right shoulder and slightly bring your elbows over toward the left. Then we'll do the opposite. Look over the left shoulder and slightly bring your elbows over to the right. Keep those shoulders pressing down. Breathe right between your shoulder blades. Come back to center. Unwrap the arms. Inhale, open, pull back. Exhale, left arm on top. Give yourself a wrap. Try to find your shoulder blades. You can stay here or wrap into eagle. This time we'll start to the left. Look over toward the left shoulder. Slightly pull the elbows across to the right. Keep your shoulder blades down. And we'll look to the right. Bring those elbows across to the left. Bring everything back to center. Unwrap, take one more chest expansion. Open. Now hold this chest expansion. So I want you to try to keep your elbows behind your body slightly. And as you do, you'll reach the right arm up, just as if you were sliding your arm along a wall that was behind you, and then pull it back down. Slide your left arm up and bring it down. Elbows are still back. Now slide that right arm up and side bend your entire body. This is going to open up your lat. Bring it back up, slide that elbow down, keep it behind you as much as you can. Left arm reaches, side bend your entire body. And come up, both elbows back, one more each side. Slide the right arm up, side stretch. Coming back, one more, squeeze those elbows back. This is going to help us with which assessment? Yes, I know you're all saying it to me. The back scratch test. Now reach that right arm up, side stretch your body, and then try to take your right fingers and touch way behind the back of your head, your neck. Reach up, pull down, pull that elbow back. You should be feeling your upper back muscles really firing. You're doing this actively with those muscles. Once you come back down, squeeze those elbows back one more time. Inhale. Exhale, touch your palms. Close your eyes for a moment and just check in. Check in on how your neck's feeling, your shoulders, your upper back, your lats, even your core. And then place your hands back onto your knees. All right, we are going to come to a stand. So take your time, any way that you need to come up. And come where you would consider the top of your mat. My knees feel like, wow, it's about time you came up out of that cross-leg position. So if you feel like me, shake those legs out a little bit. Get the blood flowing back into the entire leg. Okay, so we just learned a progression right here, here, here. So we are going to do that while we're standing up and using our legs. So standing in your mountain pose, bring your arms to goalpost. Now you'll be able to kind of see a side view of this. So pull your elbows back, lift your right arm up and keep it back behind you as much as you can. Side bend your body, and then with that right hand, try to touch the back of your neck. Reach the right arm back up and come back to neutral. Pull those elbows back. We'll do it on the left side. Left arm reaches. We side stretch to the right, and then we try to touch the back of the neck or upper back. Straighten it and rise up. Then close your palms together. So if you feel pretty comfortable with that, we're going to add some lower body work. If you want to stay standing in mountain pose and just work on that without adding a lunge, that's absolutely fine. So we are going to step the right foot back into warrior one. So you'll take a nice step, let your heel plant, keep your hips squared forward, and then open out into that goalpost. Really pull those elbows back, open up the chest. So right here, we'll add the rest of the sequence. The right arm lifts and try to keep it pulled back. Side stretch over to the left, and then take your right fingertips and try to touch the back of your neck. Straighten that arm, and then come back to your goalpost. Press your palms together and step the right foot forward back into mountain pose. We'll do it on the left side. The left foot steps back. Slight turn out of the toes. Let your heel drop down. Open out into goalpost. Expand through the chest. Lift your left arm slowly up. We side stretch to the right. And then we try to touch the back of the neck. Straighten the arm. Come back to goalpost. And step in. Now you can keep that sequence the same, or we can add the arm that comes behind us when we do our cow face arms or our back scratch test. So we'll stand in mountain, palms to touch, step the right foot back, warrior one. Open the arms, pull into goalpost, squeeze the shoulder blades. Lift your right arm up. Take your left arm and rotate it inward and try to reach your left fingertips up your back. Side stretch to the left, and then try to touch your fingers as closely as you can together. Try not to drop your chin, so keep looking forward. And as we come back up, the right arm lifts, keep it up as high as you can. Release the bottom arm very carefully from behind your back. Pull back into goalpost. Step forward into Namaste, Anjali Mudra. Left foot steps back. Open out goalpost. Left arm reaches up. Right arm rotates, bring it behind your back any amount. Now if this is feeling uncomfortable, if you feel any pain, just bring it to your hip or a small position back behind you. But if you feel like you have that flexibility, really reach those fingertips up your back, side bend to the right, and then bend your left elbow, trying to touch your fingertips as closely as you can on your back. Gaze is forward, abdominals are in. As you come back up, straighten the left arm. Very carefully drop the bottom arm down first before you pull it out. Come into goalpost. And then step into namaste. We're going to do this one more time on each side. And if you need to leave any of this out, make it suit your body. Step back right foot, warrior one. Open out goalpost. Activate the upper back. Keep your hands pulled back as far as you can. Lift your right arm up. Left arm rotates and you reach that arm behind your back any amount. Try to work your fingertips up your spine. Side stretch to the left. Bend your right elbow to try to touch the fingers. Breathe, breathe. Come back up, straightening the right arm. Slide your left arm down first and then rotate it from behind your back. Come back into goalpost. Step into namaste. Left foot steps back. Here's our last sequence. Warrior one. Open up, goalpost. Stabilize through your lower body. Core is tight. Left arm reaches up. Right arm rotates, reaches behind you. For most of us, this is the tighter side if you're right hand dominant. Side stretch to the right. Bend your left elbow. Try to touch your fingertips. Keep your head up. Breathe and hold. Come back up. Reach that left arm up. Right arm drops down. For those of you who are my dancers, you know about this position. It's called the hammer lock, when your hand's behind your back. And it can really wrench a dancer's shoulders if we don't drop the hand down first. Okay, let's step into namaste. Then relax the arms down. Activate your shoulder blades so you're standing really tall, pulling those shoulder blades back, increasing the distance between the front of your shoulders, and take a breath. And exhale completely. All right, as we are standing, if you are a participant who likes to use the wall for push-ups, I'm going to show you our interval that we'll be doing today using the wall. So if you're using the wall for a push-up, you'll have your hands a little wider than shoulders distance. You'll walk your feet back, lift your heels off the floor, do your push-up, and then drop your heels down and sink your chest down toward the floor and stretch your lats. So that's going to be your wall option. Some of you like to use a chair for push-ups. So I'm going to come down for the next demonstration. If you want to come with me, you can try it from your chair. You're going to take your hands again a little wider than your shoulders distance. You'll do your push-up. Make sure your elbows aren't going out. You want to keep them in close. And then you'll come back like you're doing a child's pose and get a good stretch for your lats and those chest muscles. So that's our next option. Third option is to come all the way down to your mat. And you can start in a child's pose if you need to see where your hands need to be for your push-up. So it's from a child's pose coming forward. You'll do your push-up, any amount, and come back to your child's pose and let your shoulders stretch. We can keep going up and advance this to a downward facing dog. This will be our shoulder stretch, our last option. Then coming forward to our plank, either from your knees or your toes, you'll do your push-up and back to down dog. So we have lots of options. Do you know which one you want to take? So make that decision now. We have got a pyramid. So over the progression of this pyramid, you're going to be doing 25 push-ups. And I know I just all heard you say, oh, but I don't want you to think about it in a block of 25. That's what's important about interval training. We take it in small bites. So with the pyramid, we're going to start with one push-up, then two, then three, then four, then five, down to four, down to three, down to 2, down to 1. That equals 25. We're going to take it up in the pyramid, then we're going to bring it down. So wherever you are you on the wall? Are you on a chair? Are you on your knees? Or are you on your toes? I want you to find your stretch first. So come into your stretch. This is where you'll come between all of those push-ups that you're going to do. If you can't get all 25, that's okay. Just do your best to get as many as you can. And you don't have to do a full push-up. You can just slightly bend your elbows, especially if you're up to that number 5. All right, let's get ready to prepare. This is 1 push-up. So from your stretch, come forward, get good alignment. Keep your core tight, do 1 push-up, any amount that you can go down. And then come back to your stretch. 2 push-ups. Inhale, come forward. Any amount, good form, good alignment. We have 2. Take your time, breathe, come back to your stretch. We see how this is going to go now. Ready for 3 push-ups. Inhale, come forward. You might not be going as deep on 3. 1. 2. 3. Come back to your stretch. I'm going to come to down dog on this one. Okay, take as much time as you need. We have 4 push-ups. Let's come forward. Here we go. 1. 2. Try not to rush them because this is preparing us to strengthen for chaturanga. After 4, take your stretch. Is it child's pose? Is it down dog? Are you on the wall? Are you on the chair? We're going to hit the peak of this pyramid at 5 push-ups. This is the most we have to do in a row. So let's get ready. Breathe and inhale, come forward. Get good alignment. 5 push-ups, any depth. Try to exhale on the press up. Can we do it? There's 4 for me. And 5. When you get your 5th push-up, take your stretch. Maybe you need to do a different stretch this time. Maybe you need to take your hands off the mat completely, or the wall or the chair, and stand straight up. Okay, so now we're going down. We've had 15 push-ups so far. We have 10 to go. So this is 4. Get ready. Inhale, come forward. We're on the home stretch, 4 push-ups. When you have 4, take your stretch. Can we make it? We only have 3, and then 2, and then 1. All right, whenever you're ready, let's begin. Come forward. Get your good plank, your good alignment. 3 push-ups. Easy peasy. 3 we can do. Take your stretch. I feel confident that you guys are all modifying this as to whatever way you can do it, performing to the best of your ability. We have 2. Inhale, come forward to your plank. 2 push-ups. I can go a little deeper down when I only have 2. Take your stretch. Yeah, just 1 to go. All right, whenever you're ready, come forward to your plank. Give me your best single push-up. And then take your stretch and relax. 25 push-ups. I hope you got it done in a way that was successful for your body. All right, we're moving back into the legs. So wherever you are, come back to your mountain pose. So if you're still standing up on the wall for push-ups, just come back to the top of your mat. If you're on the floor, make your way back to mountain pose. Stand nice and tall, shoulders back. Breathe. So our assessment on Tuesday was the single leg stance. So I'd like you to stand tall, balance on your left foot, pick up your right knee into single leg stance. So if you missed Tuesday's class, one of the big parts of this assessment was that your eye gaze remained forward and your hands stay on your hips for the assessment. But for class today, I'd like you to pull your elbows back and try to have your arms behind you. You can do that with hands on your hips as well. Find that good, strong balance. So from your single leg stance, step your right foot back, a big step behind you, and open out into warrior two. So you'll step back, 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 turn your body, and open out. So you might have to take a couple little small steps with that foot to get it into good alignment. It doesn't have to be a big stance, because now we're going to try to get into single leg stance. And that's going to be a little bit difficult. So what you can do is turn your body forward first, maybe bring hands in front of you or to your hips. If you need to take a couple steps, you can walk it in and then bring that knee up, or you can try to take one movement to come back up to single leg stance. So let's do this at your own pace. You'll open out into warrior two. Get yourself firm and solid, and then step back into single leg stance. So depending on how fast you're going, you might get 3 or 4 of these, or maybe more. I'm going to go about another minute on this side. So this is a different movement for us, to be able to step our foot back and turn our body at the same time. And then also to turn our body and step forward and balance. So modify any way you need to. You might even make that warrior two really small. So this is okay if you just step here and then step here. You've got 30 seconds. Okay, whichever repetition you're on now, finish this last one. Hold your single leg stance. Bring your hands back behind you or at your hips. Open up your heart and look forward. Engage your abs. Breathe. 10 seconds. Then come back to mountain pose, standing on both feet. Now you should have felt a fair amount of work in that left leg, so if you need to shake it out a little bit, take your time to just kind of reorganize, and then we'll play with that on the other side. Okay, I already know this isn't going to be as pretty because my right leg doesn't balance nearly as well. Let's try it. Come up into your balance, single leg stance, pull your shoulders back or bring your hands at your hips. Just like the assessment, look straight forward. We're going to hold before we move. Lengthen your spine as long as you can. And when you are ready, this left foot's going to step back and you'll open up at the same time. So as you turn, Open out into your warrior two. With a warrior two, we have a heel to arch alignment on the mat. So your right foot is pointing forward, your left foot is perpendicular. All right, let's step back into your single leg stance, any way that works for you. Whoop. It's going to take me a few to master this one. And then you're going to move back and forth between these two poses at your own pace. On this side for me, I might have to make my warrior two a little smaller so that I can actually do this. Ah, much better. So just play with it, explore it. See what works best for you so you feel successful. If the toe needs to tap down, no big deal. And look at my timer, see how much time we have. We have about 50 seconds. It's up to you when you move. You can stay on that balance pose as long as you'd like, or you can move one breath and then back into the warrior. We have 10 seconds, enough time to finish one more. And then once you close into your single leg stance, bring your hands back or at your hips, and we're going to hold together. It's harder to hold when that standing leg's fatigued from that work we just did. 10 seconds. I gaze forward, 5, 4, 3, 2, 1. Back to mountain pose, pull those shoulder blades back, stand tall and strong. Now we'll move into a pyramid. So we are going to have our feet hips distance apart and then slide your left foot straight back like you're on railroad tracks. Both of your legs are straight, they're staggered, maybe about 2 feet, a foot and a half to 2 feet apart. If you need a chair or blocks in front of you for your pyramid, have that at the ready. I'm going to bring my chair right where I can put my hands on top of it. So I'd like for you to bring your hands to your hips to again open up your chest and keep those shoulder blades back. When our arms are in front of our body, then it tends to round our shoulders. So bring these open, keep your spine long. Soften the front knee. We don't want a big bend, but we want to have a softness here. And start to hinge from your hips as you come down. Now you can use that chair to support your hands, but try not to allow your shoulders to round. Keep those shoulder blades pulled back. Same thing with your blocks down to the floor. You can even gently place your hands on your shin. But a lot of times in a yoga class, we'll see pyramid pose done with a reverse prayer. So it's having this hands in prayer position behind our back. So it's like having both hands behind in back scratch. So I'm taking my palms together and sliding my fingers up my back any amount. This keeps my shoulders open and holding the pose here. It is fairly difficult for me. I'm almost feeling like my shoulders want to feel strained. So I don't do this one too much. It also can kind of strain the wrists. So only try this if you feel like your body can handle it. And our goal here is to stretch the hamstrings more than anything. So if you're saying, well, I'm not paying too much attention on my hamstrings if I'm trying to do all that funky stuff with my arms, then just take this where you can go to feel this really nice stretch behind your back of your right leg. So I'm going to give you an option here to stay in your pyramid, or if you would like to advance this up a little bit, you can come into warrior 3, which is lifting your back foot off the floor, or even standing split. So warrior 3, we're just going to lift that back leg up, try to find our balance here. Our body is pretty level to the floor. Standing split, our hands come down more to the earth and our leg goes up. You might be kind of chuckling, saying, no, not that one for me. But you can also see where we could take a progression, right? And see what you can do here. Let's hold about 5 more breaths. It's okay just to be in your pyramid. Two more breaths. Then if you were in warrior 3 or standing split, come back through your pyramid, rise up, and then switch the stagger of your feet. So your left foot comes forward, your right foot steps back. Make sure you're not standing on a balance beam so we don't have the feet directly behind each other. And square that right hip forward so your pelvis doesn't rotate. Hands can be at your hips to open up your chest. Let's start to hinge. Make sure you've got that soft little bend in your left knee. And we were on that right side for quite a while, so let's decide where you want to go here on the left, using any props that you need. And being well aware that our bodies are not symmetrical right to left side, so you're just exploring your range here. Keep breathing. Sometimes we get into a stretch and there's some signs that our body's trying to fight it, maybe some shaking in the muscle. So if you're feeling anything, any pain or signs that you're getting a stretch reflex, then just come out of it for a little bit. Shake out the legs, whatever you need to release that message from the brain to the muscle, and then come back in. All right, so we can stay here in our pyramid. We can advance this if we want to work balance to warrior 3 by picking up the back leg. And we can let go of our props, see if we can balance. Or we can dive the upper body down to the floor, to the blocks, and lift up the back leg by firing the glute for a standing split. Lots of options, lots of choices, lots of ways we can explore where we can take this. About 30 seconds left on this side, so maybe 5 slow breaths. Then if you're in standing split or warrior 3, come back through into your pyramid. Then rise your upper body up. The back foot steps forward as we come back into our mountain pose for the last time. All right, so we're going to do a nice prone neck stretch. This is a reverse shavasana. So let's inhale, sweep the arms up. Exhale, swan dive into forward fold. Inhale, halfway lift. Exhale, fold and step yourself back to your hands and knees. and a brief child's pose. So if our prone shavasana is bothersome to you for your neck, and it doesn't feel like it works for you, what I want you to do is stay in child's pose and bring your hands next to your body, and you'll just turn your head to the right and try to relax here. So that's one option. And then you'll do the same thing on the left. Otherwise, our prone shavasana or reverse shavasana will come down onto our belly all the way down. And then we'll turn our head to the right, laying our left ear on our mat and relax. And you'll know kind of right away if this is going to be okay for your neck. And you might need to take a little hand towel or something to support yourself to make it more comfortable. If you say, I could stay here maybe 10 seconds, but that's about it, then I want you to stay there for the 10 seconds and then lift up with your chest and turn your head back to center until you can come and try it again. So just relax your shoulders. Reverse shavasana, your palms are facing the ceiling here. Your feet are about hips distance apart. Your toes are pointing in towards each other, so your thighs are rotating inward. And we're looking at staying here another 30 seconds if you can. Another option if you're in child's pose is you can do a thread the needle, because that turns your head to the side, right? So you could slide your left arm underneath you on the floor and do your thread the needle twist. All right, let's take one more breath here. And then bring your head back to neutral. And if this feels okay for you, lift your chest up and come into locust. Your legs can even come off the floor. Breathe, breathe. So if you were doing this neck twist in child's pose, just come down to your belly and do a little bit of a locust. Nice upper back strengthener, lower back strengthener, glutes, down into the hamstrings. All right, now as we lower down, our head will turn to the left. So place the right ear down toward the mat. And just check in to see if this is okay when you're laying on your belly. This is a wonderful passive neck rotation. But if you have really reduced range of motion in your neck and neck problems, this might not be okay for you. So take those options of child's pose with your head turned, or a thread the needle with your right arm shoulder down on the ground underneath you. And again, if you can just stay there maybe 10 seconds, come out of it and try again. And try to really relax your jaw here. So try not to clench your teeth. Make this as comfortable as you can. It's pretty rare that we do this in our LisaBug yoga classes, and I think it's something that would be a good idea to revisit. But I'd like to hear from those of you that are with me today, how this feels for you, how the modifications worked for you, so that I kind of know where to go with my instructions on this one in the future. Let's take one more breath on this side. And then lift your chest up, turn your head to come back to center. And if you feel comfortable, lift up into your locust. Now, what's really important when we do locust is that you don't look forward with your chin, because that really tightens that back of your cervical spine. So lengthen the back of your neck. You're still looking down, or maybe just a couple inches ahead of you, but you're not looking forward at the wall. So almost keep your chin tucked. Squeeze your bum. Lift those legs up if you can. Lift your chest up as high as you can. 2 more breaths. And then simply slide your hands right underneath your shoulders. I guess we're going to do 26 push-ups today. Let's go. Push yourself up. Back through your child's pose, or maybe even a cat stretch might feel nice. Just tuck your tailbone underneath. Round your back, releasing any tension in your lumbar spine. Staying there as long as you need, or moving around a little bit, cat and cow, some rotation. And when you feel all of that tension is loosened up, we'll start back where we began, or we'll finish where we began in our simple cross-leg pose. Nice long spine, close your eyes. And we'll take one more chest expansion by bringing those arms to goalpost, pulling the shoulder blades back. This time, keep your arms back behind you as much as you can and slide both arms up, up, up. Then bring the palms together above your head and press into your palms. Engage through your pecs as you bring your thumbs into heart center. We'll close our practice today with this mudra, a sign of honor and gratitude. I am so grateful for each and every one of you for all of your support for LisaBug programming, and honored to instruct you this morning. The light and joy that reside within me honors the light and joy in each of you. Namaste. Thank you so much, everyone. If you can stay on and chat, I would love it. If you have any questions and you can't stay on and chat, just fire me a quick little message. I always love to hear from you one way or another. Hope everything felt good, everybody. All right, recording is off.